Welcome to Mr. Giant Reacts and Ting and Ting and Ting. I'm Mr. Giant and I'm back with another one for all you. Yes, I. And you know, one of the big questions around the world, it seems, is healthcare. Should the government pay for it? Shouldn't the government pay for it? Is it going to cost too much? Wait time? All that crazy stuff. And I know healthcare is a major issue right where I am here. And people are always bringing up the Canadian healthcare system as it relates to the American healthcare system. So we're going to watch this video here, the road ahead for Canada's healthcare system in 2023. Let's see where they're going, because I'll be honest with you, here it's a mess. Let's YouTube and simmer and see what's up with this.
Senior health reporters Christine Birak and Lauren Pelly, you have both been ahead of so many health and medical science stories this year. We need you to keep looking ahead. Christine, we'll start with you. What's your sense of what will be the dominating health story next year?
I just had a doctor tell me, Christine, these are the final days of the Canadian healthcare system as we know it. It is collapsing. Is that an exaggeration? Maybe. But Lauren and I have spent a lot of time in emergency rooms and doctors' offices, and we can firmly say that they are short-staffed and there is a flood of patients. It is unprecedented, the crush inside our hospitals, and it really does feel like the healthcare system is dangling by a thread and something's got to give. And what we're hearing from the provinces and the premiers is that give is money, and they want it from the federal government, and they don't want any strings attached to that money. Ottawa, the federal government is saying, well, listen, there's money, but we want accountability. We're not writing blank checks. We want money for mental health. If you say you're going to bring down wait times in ERs, we want to see you do it. We
True.
want to see how this money is spent. We want health data so we can fix the system as we go. And stuck right in the middle is the medical community.
So if the conversation is we need money now, where does that put the conversation about private money, private healthcare?
That is the billion-dollar question. I think that the conversations that happen and the money that gets spent is going to shape our healthcare system for decades to come. So it's about to happen, and we'll see whether that money makes our system a more equitable public system that runs better for everyone, or it'll become more of a user-pay private system that is sped up for some people, and it very well may depend on where you live. But at the same time, there is a silver wave of patients that we've been talking about, boomers coming into the system. We're watching what's happening with kids right now, and the system has to change. And
I tell you what, okay? The difference I see between private healthcare system and let's just call it public, the system that we pay a government to maintain. I think that we the people could procure some kind of transparency if it's the government, since we are paying them to oversee and make sure everything is running well, whereas a private company could have all kinds of loopholes and stuff and all kinds of things they could do to make money. Then it's absolutely for profit. So with it being for profit, they could do what they want. Like where I work, the healthcare that we are provided, which I don't have, I'll be honest, don't have no healthcare. And that's why I eat healthy and try to stay healthy. But they could pay whatever they want. They could pay whenever they want. Tell you how much you need, what's the deductible and all of that. The government could do that too, don't get me wrong. And I don't understand the government's healthcare system because there's not one here. But, I'll give you a perfect example. I remember one time when I was married, I had healthcare through the place that I work. And ex-wife was on it. And one time she had a toothache and couldn't get to a dentist, so she went to the hospital. And we had dental on the insurance, but they refused to pay it because they said she went to a hospital instead of going to a dentist. So they both kind of refused to pay it because one saying it's a dentist thing, one saying it's a medical thing as far as a doctor, MD is concerned. So, they could do whatever they want. I use that healthcare. I paid into that healthcare for 20 years and never used it once. Not once. So that's just money I pay out and it's gone. Now, I don't know if it will work the same with, because like I said, I am not well versed on this. Check me in the bottom. I'm not being an expert on this. I'm paying into something that if I don't use, the money is gone. Whereas if the government is doing it, then that money will go to help somebody else, which I'm fine with. I am so fine with it going to help somebody else who needs that help. You know, understand what I mean? So, yeah, so I think the problem here in particular is we pay into the healthcare if the government do it and we don't know where the money is going because they would take money here and put money there and put money there and put money to military. Now, it might not be happening, but I'm assuming that's what's happening with a lot of the taxes we pay. It's going to places where it doesn't really benefit us. With private contractors doing this and doing that and doing the other. And lobbyists doing this and trying to get money for this and money for that. Because, I mean, the infrastructure is bad. But that's a whole other story there. We talk about healthcare. I think it would be a lot more, how should I put it? It would be managed a lot better if the government do it, if we, the people, pay attention to what they do with the money, other than just sitting around thinking, okay, they have it, you know, they could just do it. However, one of the main things that's keeping it back from happening here is because they have people, a lot of people believing that if the government do that, that's communism. So here we are paying high medical expenses and health insurance by private companies, and most of us don't have the health care coverage that we need. Plus, even if we have the health care coverage that we need, those private companies could decide if they want to pay it or not. They will research so that they don't have to pay it. And I have people at work that are complaining so much of that. No, I'm not just talking about it and out of it. I'm listening to people at work complain about it, you know. I think last year one of my co-workers said she paid so much for something, and this year she paid twice as much for the same thing, and that the insurance company just wouldn't cover it at all. Let's get back to this here. I just have rudimentary understanding of it. Hit me up in the comment section. Hit me up.
We all want it to be there when we need it.
So the shifting demographics, Lauren, this worry about an aging population, what does that change about healthcare in 2023?
Well, let's put that in perspective. So the figures Canada is using is that the 85 and up population, that could triple in the next 25 years.
Wow.
Triple. So that's a lot more seniors in this country, people who actually use healthcare the most. Those are the people who are the most vulnerable to issues like flu, to COVID-19. Those are people who need to have, supportive housing around them. They need home care. They need long-term care beds. One of the big pressures in our healthcare system for many, many years now has been alternate level of care patients. And that's a term hospitals use for those people where they shouldn't be in a hospital, but there's just nowhere else for them to go. So this is sort of underpinning this whole conversation is we have all these immediate pressures on the system while our population is aging. How are we going to handle that in the decades ahead is a big question this country has to answer.
Sounds like you'll be spending a fair amount of your year on that. Interesting, you said COVID-19. That's the first time this conversation it came up. It hasn't gone away, but is it going away? Is it still going to be in the headlines next year?
There's two metrics that I keep an eye on. One is COVID hospitalizations across the country, and the other is COVID deaths. Unfortunately, COVID hospitalizations are rising, not just in Canada, but also in the United States, and probably will into the beginning of next year as well. And then there are deaths, and we are sitting at about 250 Canadians dying every week still from COVID. And we're on track to hit 50,000 COVID deaths in total, probably by the end of January. So that said, and that number is heartbreaking, Canadians have done a really good job comparatively protecting themselves and protecting the people around them. But like you said, COVID is not gone. It's not going anywhere. And we really have to make some decisions. People have to make decisions about how they're going to protect themselves going forward. And that's vaccines and public health measures.
One of the things we've talked about a lot is how COVID has been an accelerator for the good and the bad. One of the good things has been the attention, the money, the research into mRNA vaccines. Is it your instinct that we're going to see mRNA vaccines applied to a range of other situations next year?
Well, that's definitely in the works. And I think when you look at just the COVID-19 situation and how vaccines helped reshape the pandemic, one physician explained to me a while ago that the severity of this disease, while still bad, while still concerning, has sort of been knocked down a peg as we've built up that immunity. So companies are now betting big on mRNA shots. Moderna is trying to develop a universal flu vaccine that would target all the known strains. Other companies are working on vaccines against cancer, everything from melanoma to cancers of the throat, the head, the neck. All of this is a long way off. You know, they still have to go through clinical trials. But if they have wins on this front, we could really have some amazing tools to beat back some really devastating diseases. Not just COVID, but more than that.
Okay, so we have 1 minute left. So just a quick whip around. Something that I don't see coming, but you do next year.
Well, I think all of us have been, waiting for what will be the next pandemic, right? People are so nervous after watching COVID. But for me, I'm also watching all those other known threats because we've seen everything from fungal infections to STIs come roaring back in certain ways because of antibiotic resistance. We're seeing diseases like measles and cholera and polio, some things that people have never even dealt with in their lifetime, come back because of issues like vaccine hesitancy. So all of these are familiar to us. Things like avian influenza exploded this year.
See, that's the thing that the fight against taking vaccines is causing a lot of the stuff to come back, you know what I mean? Because people have been so, I don't know what term to put it, but they've been like rammed with so much conspiracy theories that they don't believe anything anymore. Everything has to be tested. And usually when it's a dire situation, they're going to test it on the people to slow down what is causing the issue, what is causing the virus or the illness. They're not going to say, well, it's going to be about 10 years or 5 years in advance as people die. They're going to say, well, hey, you have a choice here. We either go it straight, worry about what the after effects is, especially since we know it's like 95%, 96% useful, for lack of a better term there. But, so are you going to find a lot of things coming back? Because a lot of people, not everybody, a lot of people think that they're going to put a chip in you, they're going to put a chip in you. But it's private companies that are creating these things, So especially if you think the government is doing it all. No, it's private companies, and it's for profit too. You got to keep that in mind. You know what I mean? This kind of deviate, I thought it would have been like something totally about the Canadian healthcare system, but comment down below. They say long wait times, Asian populations and stuff like that. Now, the long wait times is something that is used here to not get universal health care. Comment down below. Tell me how that works for you, especially my Canadian peeps on here, the Canadian giants. That's what I call the people that watch my show, the giants, you know what I mean? So comment down below. Let me know. Tell me what it's like there. If you go to the doctor, how much do you have to pay? You know what I mean? Is it mostly covered? After all, taxes are high so that you could afford it to get good medical care and stuff like that. Like I wouldn't have any problem paying higher taxes if I know I'm going to get the medical treatment that I need if I need it.
And I'll have more on that later this week. But that's some of the issues I'll be watching. It's not just the unknown, but it's the familiar that I think will be a big concern for us going forward in 2023 and beyond.
Can you do it in 10 seconds?
Oh gosh, variants. We never saw Omicron coming at this time last year. I want to see where variants are heading. There's great surveillance that's happening in this country. We'll have a story coming up on it because we want to know, after Omicron in the Greek alphabet comes pi. Is pi coming?
Oh, no pie. No pie.
It's just holiday pie we're thinking about.
Oh, just holiday pie, absolutely.
All right, Christine Birak, Lauren Pelly, thanks very much.
Very well.
All right, thank you for watching this with me, you know what I mean? And healthcare is a big deal. Everybody's telling me, we're going to do healthcare, That's one reason why I want to go back to the island. I'll go to the bush doctor. I know I'm making light of it, but like in the Caribbean, growing up, especially back then, when you have a major healthcare crisis, you got to fly out. You know what I mean? At the time, they didn't have the facilities or the capabilities of handling like really severe medical trauma. So we had to fly out a lot. So I think on the island, the emphasis on staying healthy is more important, because what is it my mommy says? The prevention is a lot better than cure. So we try to prevent stuff from happening by eating healthy, planting our own food. You know what I mean. That's why fast food restaurants aren't very popular there, because so what they call fast food back home, a box of dead. That's what they call it, man. So I think it has to start first with us eating healthy. It's not going to stop everything, but it is going to build your immune system if you eat healthy. I've been lucky, never got that virus. I don't get sick very often, knock on wood. But I'm getting older, so then at some point I'm going to need to have health care, you know what I mean? And it's got to come from somewhere. So, do you think it's working for you where you are? Because what's happening here, and I have to admit, it's not working at all, man. It's not. It's working for those who could afford it, but for those of us who don't and can't afford it, we just left out there. So that's why I try to eat healthy. Anyway, man, thank you all for watching this with me. I am going to leave a link in the description for this video. You all could go check it out and take, and I'm going to do a little bit more research on the Canadian healthcare system and the British healthcare system. And I hear a lot of cons about it here, not so much the pros. Hit me up with some pros down there, let's see what the vibe is, okay? You all take care of each other, all right? Take care of yourself, please do. Cool runnings.